The community of Numuel in the outskirts of Basse operative region has been locked down following confirmation of a case of the COVID-19, while health authorities try to figure out the nature of the virus in the area. The Gambia has, since the declaration of the coronavirus as global pandemic, been confined of 2 confirmed cases, one of which have died on Sunday. At a press conference today, the Director of Health Promotions and Education, the case was confirmed on a 71-year-old Gambian who returned from France on March 17. He flew into the ASCII flight TFL 58, which had 59 passengers in number, exactly the day Gambia confirmed the first confirmed case also on the traveler from Europe.
A 71-year-old Gambian of Upper River Region area of Numuel, who recently returned from France, arrived in the Gambia on the 17th of March 2020 at 1:31 hours by a TUI Akifly TF with flight number TFL 458 and traveled to Numuel. How he traveled to Numuel is not yet clear to us, but our team are also investigating that to find out his route of travel from the airport to Numuel. In that particular flight, there were 59 passengers were on board. According to and also the manifestation symptoms began on the 20th of March 2020. He first reported to the OPD of Basse District Hospital with symptoms such as abdominal and chest pain in the early hours of the 21st of March 2020. He was escorted to the hospital by 2 escorts who brought him on a motorcycle. He initially resisted sample collection, but sample was later collected on the 21st of March after the intervention of the PIU, the Police Intervention Unit. Samples sent to MRC at Fajara for testing on the 22nd of March. The result became positive and received on the 23rd of March. He is currently on admission.
Our correspondent Ibrahim Ba is live on the line at the Central Medical Stores in Kotu, where the press conference just been held now. Ibrahim, what is the mood on the ground after the confirmation of the third case of the coronavirus in the Gambia?
Yeah, so today's press conference was characterized by frank questions from journalists as to the need for timely and accurate information from the Ministry of Health and Social Welfare. As you know, the journalists were here since morning hours to wait for this daily update, but the press conference didn't start until some 4 to 5 hours later. So this was a concern that journalists were here to put across. As you know, it is a situation when many people and then almost everybody is relying on the media as to the speculation they are getting, how they, verify and then authenticate the information. So journalists were also under pressure and have to put that same pressure on the Ministry of Health and Social Welfare.
Yes, and was the announcement of this case part of the public expectations from the ministry today?
Sure, partly one can say yes, because going by the social media, speculations continue to make rounds on the media as to the number of cases and then suspected cases. This is not definitely one of the unexpected scenario, but the good news is it is one case. Again, one would have thought that the allegations or the rumors that we are making rounds of number of cases from different corners were not substantiated by the Ministry of Health today.
All right. Now, what is the next step for the government?
Yeah, the confirmation of third case in the Gambia, signifies a very busy moment for the Ministry of Health and government and even the public now. Initially, it was one case that we talked about in this country. Later on, a second case who is a Bangladeshi who died on Sunday. And now this is a Gambian who returned from France, as you the people he shared with the flight, need to be traced now. So the tracing tactics by the Ministry of Health need to be reinforced, and government has no excuse now to delay its way in getting the coronavirus out of the country and controlling its further spread.
Ibrahim Abba, many thanks for joining us live from the Central Medical Stores in Kotu. Now, from that update on the press conference that was earlier on held on the situation of the coronavirus in the Gambia.